The Antidepressant Skills Workbook is something I developed in the context of working in a mental health knowledge translation research group at Simon Fraser University. The aim is to take evidence-based knowledge that we have and get it out into practice in a feasible and practical way. So that's what this is about. It's free download, so that was one of our first decisions in making this particular workbook, getting it out there, was to make it free. That seemed to be the least problematic way to get it out there. We have it translated into both scripts of Chinese, Punjabi, and French. We have different versions of the workbook developed over the years. There's one for adolescents called Dealing with Depression, another book called Antidepressant Skills at Work, one called Positive Coping with Health Conditions, all of which takes what we know about cognitive behavioral approaches to mood and anxiety issues and puts them into a format that is relevant and appropriate to different populations and different contexts. All of them are free. There's also an audiobook version of the Antidepressant Skills Workbook people can download if they want to listen to it instead of read it. There's also a relaxation training audio file up on the website that is going to be especially relevant for pain, and it's a straightforward skill acquisition relaxation training module, and there are no subliminal waterfalls in it. The workbook, first of all, we've done research on dissemination of the workbook as part of a brief intervention within primary care. We'll talk later about 81 physicians who distributed and supported their patients in using this about 1,300 times over a 6-month period, a very high rate of uptake. We track it internationally in terms of what's happening with the download from the site. In fact, across the country, BC and Alberta have a pretty high rate of use, but the highest rate of use at this point is in Quebec, and they're going to bring me out to do some webinar training en français, which should be fascinating. The book itself it builds a basic CBT model of how mood problems develop from situations, and pain would become part of a life situation that somebody is reacting to. If someone thinks about that situation in catastrophic negative ways, if they experience the despair and numb feelings that can accompany depression, if they have the physiological responses and the behavioral withdrawal, all of those things are going to worsen the pain experience. They affect both how the pain is evaluated and other factors that relate to it and how compliant they'll be with good practices. All of those mood issues will worsen pain experience and become very much part of the problem. The skills that are taught within the workbook are evidence-based, straightforward, how to reactivate your life, specific achievable goals like the behavioral goal setting you were looking at, realistic thinking, helping people to identify maladaptive unfair cognitions which worsen pain experience and how to change them, how to resolve problems more systematically, structured problem solving, and also how to physically and mentally learn to relax yourself, again, using that audio file training. Benefits: low cost, demonstrated low risk, and demonstrated to be quite effective. Simply handing out a workbook has been shown in research to get you a standard deviation improvement of about 0.4, which is pretty good for a virtually free intervention. Giving some coaching, some encouragement of the kind that is feasible within primary care doubles that effect size and makes it pretty significant for an intervention that fits within your limited time intervention and is virtually free. That was a study we did that BC Family Docs in that study did find it to be a useful intervention. They did it a lot, they used it, they found it fit well into their practice. Thank you.